Welcome to this video on the National Rural Health Mission, or Nrhm, and its relevance to community health nursing. As a great person once said, the only way to do great work is to love what you do. We hope this video inspires you in your journey. Nrhm was launched on April 12, 2005 by the Honorable Prime Minister Dr. Manmohan Singh. Initially running for 7 years, it is now a sub-mission under the National Health Mission since 2013, overseen by the Ministry of Health and Family Welfare. This launch occurred during the 10th five-year plan. The vision of Nrhm is to provide effective health care to the rural population, especially vulnerable groups. Key goals include reducing infant and maternal mortality rates, ensuring universal access to public health services, and preventing and controlling various diseases. Nrhm specifically focuses on 18 states with weak public health indicators. These include the 8 Empowered Action Group states and 8 northeastern states, plus 2 hilly states, Himachal Pradesh and Jammu and Kashmir. Core Nrhm strategies include decentralization through village health and sanitation committees, strengthening existing health centers like subcenters, PHCs, and CHCs to IPHS standards, flexible financing, and communitization, notably by introducing ASHA. This scene shows the institutional framework. Please refer to the text content on the screen for details. ASHA, the accredited social health activist, is a key functionary. She serves as a vital link between the community and the health system. Selection criteria include being a village resident, married, widowed, or divorced, minimum 8th pass education, and being 25 to 45 years old. This scene highlights the population norms for ASHA. Remember that the Gram Panchayat or Gram Sabha are key to this structure. ASHA's responsibilities include creating health awareness, mobilizing communities for immunization, escorting pregnant women for institutional delivery, providing primary care for minor ailments, and notifying births and deaths. She also acts as a depot holder for contraceptives and essential medicines. ASHA is an honorary volunteer and receives performance-based incentives, not a salary. Examples include incentives for promoting institutional delivery, full immunization, toilet construction, and family planning. ASHA is equipped with a drug kit containing essential medicines like paracetamol, iron folic acid tablets, oral contraceptive pills, condoms, ORS packets, zinc tablets, and rapid diagnostic kits for malaria and pregnancy. Let's quickly review some key facts. Nrhm was launched on April 12, 2005. ASHA's minimum education criterion is 8th pass, and the population norm in Plains is 1 ASHA per 1,000 population. Nrhm focuses on 18 high-focus states. The Village Health and Sanitation Committee, or VHSNC, operates at the village level, chaired by the Sarpanch and convened by ASHA. Members include Panchayat members, ASHA, ANM, and AWW. They receive 10,000 rupees per year as an untied fund for village health planning. The Rogi Kalyan Samiti, or Patient Welfare Committee, functions at PHCs, CHCs, and district hospitals. It is a registered society that manages hospital affairs. The RKS can retain user charges to use for improving patient amenities and the quality of services. The subcenter is the most peripheral contact point, serving 5,000 people in plains and 3,000 in hilly or tribal areas. Staff includes 1 ANM and 1 MPW, with Nrhm adding a second ANM. Subcenters also receive an untied fund of 10,000 rupees per year and are being upgraded to health and wellness centers. Under IPHS norms, a primary health center covers 30,000 in the plain or 20,000 in hilly areas, providing the first contact with a doctor. A community health center covers 20,000 or 80,000 people, is staffed by 4 specialists, and acts as the first referral unit. Janani Suraksha Yojana, or JSY, launched simultaneously with Nrhm on April 12, 2005. Its aim is to reduce MMR and IMR by promoting institutional delivery among poor pregnant women, offering cash assistance to the mother and an incentive to ASHA. This scene provides details on JSY incentives in low-performing states. Please refer to the text content on the screen for the specific amounts. Janani Shishu Suraksha Karyakram, or JSSK, launched in June 2011 with the motto Zero Expense Delivery. It benefits pregnant women and sick infants up to 1 year old, ensuring free delivery, drugs, diagnostics, diet, blood, and free transportation. Rashtriya Bal Swasthya Karyakram, or RBSK, launched in February 2013, targets children from 0 to 18 years. Mobile health teams, including Ayush doctors, visit Anganwadis and schools, focusing on the screening and early intervention of the 4Ds. The 4Ds of RBSK are defects at birth, deficiencies like anemia, diseases such as dental caries, and developmental delays and disabilities like vision or hearing impairment. Rashtriya Kishore Swasthya Karyakram, or RKSK, launched in January 2014, targets adolescents aged 10 to 19 years. The strategy involves the 7 C's, including coverage, communities, and clinics. Key initiatives are WIFS for weekly iron folic acid supplementation and adolescent-friendly health clinics. Suman, launched in 2019, assures dignified and quality healthcare at no cost to prevent maternal and newborn deaths. Lakusha, launched in 2017, focuses on improving the quality of care in the labor room and maternity OT to reduce maternal and newborn mortality. Here is a quick summary of schemes. JSY cash assistance in rural LPS is 1,400 rupees. JSSK's main feature is free or cashless delivery. RBSK covers ages 0 to 18 years, and Lakusha focuses on labor room quality. National Mobile Medical Units, or NMMU, bring healthcare to underserved populations. These vehicles are equipped with diagnostics and a team of a doctor, nurse, pharmacist, lab tech, and driver, with a norm of 1 unit per district. Mission Indradhanush, launched in December 2014, aims for over 90% full immunization coverage. It targets unvaccinated or partially vaccinated children under 2 years and pregnant women, initially covering 7 diseases, now expanded, with the current focus being IMI 5.0. Mainstreaming AYUSH involves the co-location of facilities for Ayurveda, yoga, Unani, Siddha, and homeopathy at health centers. This strategy includes recruiting AYUSH doctors to bridge medical officer gaps and utilize them in RBSK teams. Under Ayushman Bharat, 1.5 lakh sub-centers and PHCs are being transformed into health and wellness centers, or HWCs. A new cadre, the Community Health Officer, or CHO, is posted here to provide comprehensive primary health care, including for non-communicable diseases. Nrhm integrates various national disease control programs. These include the National TB Elimination Program, programs for vector-borne diseases like malaria, leprosy eradication, blindness control, and the Integrated Disease Surveillance Program. This scene shows various indicator targets versus current status for maternal mortality rate and infant mortality rate. Please refer to the text content on the screen for details. Emergency and referral services include the 108 service for trauma and medical emergencies. The 102 service, or Janani Express, focuses on transporting pregnant women and infants, and 104 is a health helpline for medical advice and grievance redressal. In this rapid-fire mixed bag, the head of VHSNC is the Sarpanch. The CHO is posted at the Health and Wellness Center. The untied fund for a sub-center is 10,000 rupees per year, and JSSK is the Zero Expense Delivery Scheme. The correct answer to the question regarding NRHM launch year is 2005. The correct answer for ASHA's population norm is 1 per 1,000 in rural areas. The correct answer for JSY cash assistance in rural LPS is 1,400 rupees. The correct answer for the untied fund at the VHSNC level is 10,000 rupees. The correct answer for the committee managing hospital user charges is Rogi Kalyan Samiti, or RKS. Key exam takeaways include the NRHM launch in 2005, ASHA's roles and incentives, JSY and JSSK's focus on maternal health, RBSK's 4D screening, and the function of VHSNC and health and wellness centers led by CHO. Thank you for watching this video. All the best.